Hi, everybody. Welcome to our podcast, BIA, for you, for them, that focuses on conditions that affect us disproportionately, particularly women, or conditions that affect women differently. And we have physician experts and leaders who come talk to us and tell us about what is the credible update in that particular condition. Today, we are going to talk about blood pressure. There have been new guidelines that came out, and I am thrilled to invite Dr. Thamman. Dr. Ritu Thamman is a cardiologist and associate professor of medicine at University of Pittsburgh School of Medicine. She has served on the board of directors of the American Society of Echocardiography, was the co-chair of the industry roundtable think tank for echocardiography and innovation, founder and chair of ASC's Women in Echo and ASC's Twitter Journal Club. She's a member of the AHA's Health Tech Advisory Group, served as ACC's co-chair for telehealth standards for consumer devices. She also has served on the ACC's Women in Cardiology Leadership Council, founded the ACC's PA chapter of Women in Cardiology. And her CV goes on and on. Dr. Thamman, on a personal note, is also, with all her incredible achievements, extremely down to earth, a very, very impersonable person and an amazing leader. She leads the diversity group as well. It is my pleasure to have you today, Dr. Thamman. Thank you.
Thank you, Dr. Sareen. Thank you for that lovely introduction. And it's my pleasure to be here to speak with all of you.
Thank you, Dr. Thamman. Please, if you could shed some light on blood pressure. What does it mean to a woman in everyday living? What can we do at home to know where do we lie in that paradigm and how do we approach it?
This is such an important question. So for all our listeners out there, the most important thing is know what your numbers are, first of all. 130 over 80, if you're not pregnant, is considered stage 1 hypertension or high blood pressure. So we want to do everything. If you don't have this diagnosis or don't have blood pressure that is over that, do everything in your power to keep it below that. And that involves keeping a healthy weight, keeping your BMI less than 21, eating the right types of food. It's not the calories, but it's actually the quality of your foods, making sure you're not over consuming sodium, and using other supplements for sodium if you really have a craving for that. And also making sure you get some form of exercise in. It doesn't have to be 10,000 steps, even 5,000 to 7,000 steps, anywhere, wherever you are, be active. That being said, those people, those women in particular who have a blood pressure problem, meaning it's over 130 over 80, be very mindful that because you're a female, your risk of actually having a complication because of this hypertension is more than if you were a man with that same blood pressure. And so remember that when you are told or prescribed medication, take it religiously. Take it because it matters. Women also metabolize some things a little bit different, meaning our pharmacokinetics are somewhat different when it comes to types of beta blockers, which is sometimes used as a treatment. And so your doctor should know that you may need a little bit less to get the full effect as a man would. For example, if you're on low pressure, 50 milligrams in a woman is about the same as 100 in a man. So just keep those things in mind just to minimize any side effects, because women also have side effects from medications, even though we have not been so thoroughly in terms of numbers studied in all the hypertension trials.
That is such a great point. Thank you, Dr. Thamman. Dr. Thamman made a really important point about how women are metabolically different compared to men. They are distinct entities when it comes to the hormonal profile. What about different races? Have you seen responses different across different races as well? Is there something you would tell a particular group differently compared to others, Dr. Thamman?
There are some extrapolations now because women made less than a third of the people in the trial. So a lot of the extrapolation comes from the men. But for example, if I have an African American patient, I may be really very vigilant about making sure I can get the blood pressure down with starting right away, giving a very short trial, just basic modification of lifestyle, but then immediately get into a thiazide, an ACE inhibitor, or an ARB, an ARB, because certainly a thiazide has been shown to be very effective in this group, at least in the male population. And the other thing to note is some women, in fact, end up getting complications from high blood pressure in a way much more than, say, a man would. One of the most common things is heart failure with preserved ejection fraction, which is just a fancy word for saying your pumping function is normal, but you are actually unable to really fill appropriately your heart. And so you feel short of breath and you have symptoms that are heart failure symptoms. Now, what we would really like to know is, are there blood pressure medicines that I could take now, give to my patients who that might slow the progression or maybe slow the development of HFpEF? And we don't know the answer to this. Now, there is some circumstantial evidence. And so when I do see an African American or any really of my female patients, I'll be more inclined to put an add-on an MRA, like a spironolactone, which it has antifibrotic qualities, apart from being also a diuretic. So certainly in those that have difficult to control, like they're already on 2 or 3 medications, I'll add on spironolactone in the hopes that in the future we'll have some evidence that it is going to delay or maybe halt the progression into HFpEF. We don't know that yet, but
that's really beautifully put. And I love how you brought in heart failure with normal ejection fraction in there, because there may be women out there who are short of breath, have fluid collection in their lungs, and they wouldn't know what's causing it because the coronary angiogram is okay. And it's, sometimes we fail to tell our patients it's your blood pressure. You just got to make sure your blood pressure is well controlled. So 2 really important points that Dr. Thamman made was, 1, know your medication, because a particular medication may be better for a woman compared to men, male counterparts. And 2, understand how hypertension itself can lead to other causes, other problems, other health conditions. Dr. Thamman, in the recent guidelines, there's more focus on lifestyle change. Are there any specific recommendations about diet and exercise you'd like to give our listeners?
I think that the guidelines are very clear and in saying, obviously, know your numbers, and that includes your cholesterol along with your glucose, fasting glucose. But the main thing, of course, is to keep your weight in a normal range, to be active as much as you can. Those 2 things then impact all the others, because if you're not active or you're overweight, you're more apt to be glucose or insulin resistant and have a higher glucose, et cetera. So really, that's a big focus. One new thing that the guidelines did say is don't drink. It's a class 1, meaning a very strong indication or recommendation. And so some women may find that hard, but I think you just have to remember there are other ways to reduce your stress than just having a drink, because it's not going to help you and it's going to make you more hypertensive. So remember that, please.
Well, thank you, Dr. Thamman. Point noted. Alcohol, though it was previously said 1 drink a day is okay for women, at this time, if you have hypertension or you're trying to prevent it, please avoid alcohol. Dr. Thamman, any final 3 take-home points for our listeners?
Yes. So number 1, Hypertension is a very important risk factor for women, even more so. It's even more important for us to have it under control because we are more apt to develop complications, including coronary disease, including events related like in myocardial infarction, an MI, heart attack in a vernacular, or heart failure with preserved ejection fraction. So for every if we compare ourselves to men, our risk is far greater for the same amount of hypertension. So, number one. Number two, do everything you can to minimize your risk. Keep your weight normal, exercise, and eat. And when you eat, really eat in the sense that food is medicine. Don't eat just because it tastes good, because everything you do is going to affect your blood pressure. And number three, take it seriously. It's not to be taken lightly if someone says, if you go into the doctor or you get a blood pressure check somewhere and you find it over 130, over 80, don't deny it and don't just push it aside. Just face it on. It's not so bad. We do know a lot. And if you are treated, you are able to manage your risk and have a perfectly good, normal life. So I'd say go for that.
Thank you, Dr. Thamman. Really excellent take-home points. Don't minimize your symptoms, take your medications, exercise, eat healthy. It should be a way of life. Thank you to everybody for joining us. If you have more recommendations or questions, please email us at biayourselfcontact@gmail.com. Otherwise, have a good rest of the month. Thank you, Dr. Thamman. It was a pleasure talking to you.